My VIPs are poor patients. Many people have lost whatever deposits they have, whatever hard-earned money they have, because of
Greed and
adventurous or greedy approach. In my opinion, your constituency should be your country.
country, absolutely.
Spend your money and it should actually match your pocket.
Do you think it's time India had money health camps?
We need some financial camps to educate people how to protect your money, how to invest. Health and wealth go together. If you are healthy, then you can earn some money. We should know financial management, very important.
One financial habit that you follow, that you wish that every Indian did too.
Spend your money according to your needs and it should actually match your pocket.
Since you have handled very effectively, brought up the institution, and you are also a financial acumen, if you look at extraordinarily, you have showed it in demonstration. Now I move on to the money education section. This is something that we are trying to popularize, check your money quotient levels, just like your BP or sugar levels. In your decade of service, have you seen patients suffer due to financial ignorance or like not knowing the cost of procedure or lacking health insurance?
I think particularly in cities, among the educators, I think most of them will get into the health insurance scheme. They always have some sort of health insurance. But same thing is not there in smaller cities.
Okay.
In tier 1 cities it is more, in tier 2 or tier 3 cities people having health insurance is very less. So
Yes.
that's where we need to create an awareness among them. So otherwise what happens today, particularly some for complex complicated diseases, particularly I mean the expenditure may be 10 lakhs, 20 lakhs, sometimes it can go up to 25 lakhs. So there what happens, particularly for example, if it is head injury for example, or if it is critically ill because of some infection called septicemias and all.
The
or
hospitalization number of days may get extended.
Yeah. So, and even for example, cancer, chemotherapy or immunotherapy or some complex cardiac procedures. So, they are pretty expensive. So, and particularly when there are medical emergencies. So, whether poor, I mean, they are affordable, not affordable, they want to save their kith and kin. So, then they admit them, then bill will be raised, then they are selling their jewelry, they are selling their lands. That I have seen plenty. Even many patients have come and told me, sir, we can't afford even 2 lakhs, even when I was in Jayadeva. So, I have mortgaged my Mangala Sutra, like that. So, I strongly believe 9 out of 10 are in our cultural background, nobody will tell lies on Mangala Sutra. That is my strong belief.
Correct.
So, then I have told, no, whatever money you have paid, then we will reimburse back to you. You go and wear your Mangala Sutra again. That I have told many times. So, this is very common. See, we opened one Jayadeva hospital branch in Kalburgi in 2016. So, how many letters people have written? Sir, earlier we were going to Hyderabad and we were used to sell our land, used to sell our jewelry. Now, after starting Jayadeva Institute in Kalburgi, I think we are
The access is far, at least they will not spend a lot of money on travel and staying there.
Yeah, I think health insurance concept need to be strengthened, particularly among the tier 2, tier 3 cities. And for example, there are some Government of India sponsored health schemes, I mean insurance schemes are there. For example, Pradhan Mantri Jeevan Raksha scheme, just 20 rupees a year, and the coverage is up to 2 lakhs for accidents. Why I am telling is, accidents today, road traffic accident is the 5th largest killer. So, roughly around 4.5 lakh road traffic accidents are happening every year, and nearly 1.7 lakh are dying, and the amount of money out of pocket expenditure that is spent is huge, because for a poor family, even maybe 5 lakhs, 10 lakhs is their lifetime earning.
Correct.
Lifetime earning. I think that is a very good thing. And also another aspect of money, particularly how people, even intellectual people, will succumb to these online frauds.
Frauds.
I mean, because somebody online transfer of money, then they are cheated. Because see, earlier cheating used to be very small in before this digitalization happened.
Correct.
So now they are losing in crores and crores that we have seen. And another thing, particularly in some places, the wives, that women folk, normally they mortgage their jewelry without intimating the husband. I will just tell you a small story. There was a lady who just approached me about 10 days ago. She has taken 3 lakhs loan for this microfinancing,
Okay.
and she has ended up paying 71 lakhs.
My goodness. So
Because,
gold loan.
yeah, she has taken loan
Take
direct.
loan only,
Yeah,
direct. Okay.
first. So that people were torturing her. No, no, you have to pay another 5 lakhs, another 5 lakh. And this lady, she has not revealed it to her husband.
Husband.
And she got exhausted all jewelry. Then of course now they came to me. Then we spoke to these cooperatives, because microfinancing is banned. Although it is banned, directly police cannot take action. So now it has to go through cooperative department. Cooperative department has to refer this case to police and all. So this is where, see, they don't know how to properly invest money, how to, whatever little money they have, how to preserve it, and they don't know how to make it appreciable.
Correct. So in fact, that was my question, sir. Because scams, like you said, are on the rise today.
Correct.
Because of digital usage. Every
Correct.
phone may you can lose 10 rupees also. You can buy 10 rupees, you can buy for 10 lakhs. But at the same time, you can lose also 10 rupees or 10 lakhs with giving OTPs and all. And fake apps are there, Ponzi schemes, crypto. Today, crypto coins and crypto traps are there. And do you think it's time that India had money health camps and just like with medical camps?
I fully agree with that, because we have to create awareness. What are the schemes, various schemes are available, starting from health insurance, I mean from other various
how people get cheated and what are the ways.
Yeah.
In fact, every time nowadays there are new kinds of AI related.
Because we are talking about cyber crime and all those things, how they are losing money on digital transactions. And also we have to really also highlight regarding this microfinancing. This is happening at village level, or maybe at tier 2, tier 3 cities level. And what are the schemes available, how to avail the loans from various banks at a reasonable interest. So we need to educate them, because there are some lead banks in every district. There are some lead banks. So we should this awareness, and otherwise they don't, whatever little money, hard earned money, they put it in some microfinancing and they lose once for all. And after some time, initially they make them believe that they are paying a heavy FD interest. Then on one fine day they run away.
Wonderful, sir. Actually, I will move on to the real life, this kind of situation. Like you must have huge experience and seen a lot of such people having that. We often test this money quotient level through live cases, because our money quotient test has 5 questions. It will ask actually what is your income or what is should be there, and they will get marks based on at what life stage what income should be there, what expenditure should be there, what saving should be there, how much financial asset should be there, what should be the growth. So through the life real life cases, I would love your thoughts or even personal examples for these questions, if any of these resonate with your thoughts. Many people think their FD is giving 6% and that's good. And but if inflation is 7% and they're actually losing the money. And have you seen anyone fall into this nominal gain kind of a trap?
See, actually what happens, particularly the elderly people, so they earlier that was the standard way of keeping their money intact. they used to have a fixed deposit and some interest they used to get. Out of that interest, they used to use that interest money
for
for livelihood and all those things. Now, since interest rate has dropped, so one has to look for other schemes where we can earn better.
Correct.
So, earlier it used to be 12%, 14%.
Correct. So,
Now
every 5 years it used to double.
now it has dropped to 7%.
Correct.
So, probably I think that will not be sufficient. This is where, as you said, because this health and wealth go together.
Correct.
See what happens if you have some money and mentally you are satisfied. At least when you are mentally satisfied, it promotes your health. And if you are healthy, then you can earn some money.
Correct.
But of course, the caveat is you should not be over ambitious.
Correct.
Many people have lost whatever deposits they have, whatever hard earned money they have because of over adventurous or greedy approach.
Correct.
And over ambition.
Correct.
Over ambition is bad not only as far as money is concerned, even health is concerned.
Also.
See, if your expectations are more than the performance, then there will be a stress.
Correct.
And stress will adversely affect your health.
Correct.
So, same thing affects the wealth also.
Correct.
See, we all need money, there is no question about it, but money is not everything.
Correct.
Money also should come step by step.
Correct.
So, because this is where it is happening nowadays, our IT, BT graduates start earning money at a very young age, then they do not understand the value of money, they do not understand the value of life, and as a result, by as early as 30 to 40 years, by 30, 35, 40 years, they develop a lot of health issues, starting from high blood pressure, diabetes, then mental fatigue, because their brain is overloaded.
Correct.
But heart is undernourished. Then they will have backache, then they will have stress induced various problems, they have marital problems and all those things. So, I think money should come, but should come at an appropriate time in a phased manner.
Right. So, more money also they will end up eating more and doing all that junk kind of things and invite more health problems.
Correct. If you are chasing too much of money, then you lose health. Okay. Then trying to correct your health, then you have to spend money. Both are there.
Correct. Absolutely.
So, but one thing, we should know financial management, very important. Whatever little money or whatever resources we have, it should be effectively protected and it should be appreciating.
Absolutely.
That's of course, as you said, we need some financial camps to educate people how to protect your money, how to invest, and how to really invest in a way it becomes appreciating.
Absolutely. So, many households normally do not track their monthly budgets. We just whenever money comes we spend, and end of the month we have nothing. So, most of the middle class they do that, either overspending or they do not earn well, under earning. It leads to debt and ultimately the stress, like what you connected. Have you seen in your life any career, any such experiences, any people mismanaging money and getting into trouble?
Well, I have seen hundreds and hundreds of people when they are coming to the hospital, then they say, no sir, we had so much of money, we have actually given some loan to somebody and now we are not getting it back, and so this sort of
so because of that they got into shocks. And
yes, it is. I mean, even today almost every week 4 to 5 people come and tell, and then sir, we have a larger complaint and police is not taking action. Although they are taking action, it's very difficult to catch those people. So, this is a very common thing, and sometimes they invest, then they sublease to somebody, then they sublease to anybody, I mean somebody. So, I think this is where they are losing lot of money and they are under stress.
Sir, people often trust friends and relatives blindly when it comes to investing. So, have you come across cases where lack of financial questioning before investing anything without doing the due diligence, they would cause to lot of losses and regret later?
I think when it comes to money matters, uh, in fact, there's nothing like friendship. When it comes to financial matters, so lot of friends have cheated their colleagues, lot of friends. So they make them believe, and so I think as far as the investment is concerned, so trust factor is very, very important. So I think I think friendship is nothing to do with your investment.
So they should go to the expert and get the opinion and advice from the
Correct
expert.
advice, and how best it can be protected.
Absolutely.
Even if they are lending, even if they are lending loans, I think you have to make it pakka, foolproof.
Foolproof. Okay. Sir, I'll move on to the next section. Very interesting one. This is on politics, public duty, and development. What inspired you to make the leap from healthcare to politics? And what do you hope to achieve as an MP that probably you missed out as a doctor? You didn't miss many, but as an MP, what do you think you want to do?
See, I was not at all keen on entering politics at any time. Even in my dream also, I never thought, because all of a sudden what happened, I retired in January 2024. Then same time election was notified. Soon after retirement, there were a lot of felicitations across the state. So some people are saying, you have done so much, you have brought a revolutionary reforms in a cardiac healthcare, that in a public hospital. So I think if you get an opportunity at a India level, so probably this model you can put in shape across the country, something like that. So otherwise, I was not at all interested in politics, and it was not at the back of my mind any time. So, but there was lot of pressure on me to contest. Then I contested, and people with lot of love and affection voted me. So that is one thing. And now what has happened? See, in my opinion, the duties and responsibility of member of the parliament, of course, primarily it is your constituency.
Correct.
Primarily, the constituency which has elected you.
Correct.
In my opinion, your constituency should be your country.
Country, absolutely.
So, even the issues of national importance,
Correct.
Issues of state importance, you should take part and see how best you can contribute to solve those problems or highlight them in the floor of the parliament. For example, recently with lot of efforts, we got an approval for 500 crore, 300 bedded polytrauma center for Nimans.
Wow,
that
wonderful.
that was pending for 11 years. Because perseveration is very important.
Correct.
You should not lose hope, because polytrauma center is so important, because road traffic accident, 1/3 of them have multiple injuries. We need to treat under one roof.
Correct.
Head injury will be there, thorax injury will be there, chest injury, abdomen injury, bone injuries, fractures will be there. So we need to treat them under one roof. This thing. Then also, in fact, I spoke in the parliament, and also I am going to really follow it up, that today heart attack and brain stroke is #1 killer in this country. And we have to take the heart attack treatment to the doorsteps of a taluk hospital, because today heart attack, 35% of heart attack is below 40 years of age. Young and middle-aged Indians are succumbing to heart attack and brain stroke.
In fact, that is doing lot of rounds. I saw your interview.
Yeah, then what happens?
Yeah.
So, and heart attack treatment is time driven. So, we need to give treatment within the golden hour. It is also equally common among poor people, laborers, farmers. So, precious time is lost. So, to overcome this, you see that hub and spoke model is initiated, where initial treatment like clot dissolving medicine has to be given within the golden hour at taluk hospital, and then that stabilizes the patient in 90%. Then it gives lot of time, then they can be shifted after few hours to a nearest city where angioplasty stent can be performed. So, this hub and spoke model, in fact, I spoke in the parliament, it should be introduced across the country.
Correct.
And also regarding sericulture. I raised a debate in the parliament because Karnataka is actually number one in
Correct, in
sericulture.
sericulture.
Correct. And India is number 2 in sericulture. China is number 1, number 2 we are. So we need to really see how best we can adopt technology and upgrade our production, and also how best to improve the quality of silk, and these are some of the things.
In fact, me as a finance, from somebody from finance, I was extreme. Normally, we become anyway very happy when highly educated and extremely successful people, especially that too from healthcare as well as from management, turning around the institution that you have done. When you came,
another issue was there. See, under National Health Mission, they appoint staff nurses for smaller hospital, like in the villages. That is primary health center, community health center. So they were getting only 12,000 rupees per month as a consolidated salary, and obviously nobody wants to join for that salary. Then we held a discussion. I followed it up. Then I met minister, I met secretary at Delhi, and now their salary has been increased from 12,000 to 22,000.
22,000.
Yeah, 22,000 per month, because now we need to strengthen our primary healthcare system. See, today we are only talking about few hospitals in the big cities. They are doing this great procedure, that procedure. So that is okay, but we need to strengthen our primary healthcare system. And as I said, only hospital building and equipment alone will not be sufficient. We should have sufficient manpower.
Correct.
Doctors, nurses, technicians. That's where India.
And then the ground level workers are well paid and they are taken care of. Like you said, how you put hands on a group D worker and enthuse them. It's not just that, plus along with financially, if they are taken care of. I'm sure, I think it's a wonderful. I mean, 12,000 to 22,000 is a huge.
So now this is going to really stimulate, encourage staff nurses to work in the rural hospitals.
Correct.
So this is how we have to change the policy. See, one policy change can bring huge transformation in any sector.
Correct.
There's a popular saying, micro changes bring macro transformation.
Wonderful, sir. It's an amazing statement. Actually, it can be a kind of a slogan today. Wonderful. Sir, you already covered most of it. I wanted to ask, what are your top priorities for Bangalore Rural specifically, as well as for the country you spoke, and what are your favorite areas, whether it is infrastructure, employment, health or education? And if you want to cover a little bit more, anything on that?
No, see, health, education, agriculture, infrastructure. See, coming back to infrastructure, actually, quality of infrastructure is very important, whether it is roads and we have to regenerate the lakes. We have to really promote the environment. There is actually contamination of lakes everywhere. It should be given a priority. We should develop and rainwater harvesting we are doing for only houses or buildings. You have to do a rainwater harvesting for the street
for the streets. Okay.
Yeah, wherever it is possible, divert this street rainwater into the lakes, fill up the lakes, prevent contamination. And roads, I think quality roads is important. And in Bangalore, what is happening? They are making roads without a drainage. If you are not making a drainage, please don't make roads.
Correct.
It's a colossal waste of money. And of course, we need to extend our metro actually. So now it is going up to Silk Institute. It should, in my opinion, it should go up to Harodli Industrial Hub. That is very.
I'm sure, sir. I think with your able leadership being there in terms of, especially not only for Bangalore Rural, in fact, you are talking about the whole of the country in terms of, particularly enabling the ground workers. I mean, that is most important, the primary health.
Then agriculture also, particularly on farmers' incentives, whatever, I mean, whenever there is a crop loss. For example, this time there was a mango mango problems were there.
Right.
The mango crop was destroyed because of rains and so many, because it's a weather dependent crop.
Correct.
So for that, at least you should develop these mango processing units. So whenever there is a substantial fall of mango price, because farmers will not
Storage can be taken.
farmers will not even pluck them, because they will not able to meet the cultivation cost.
Correct.
So at that time, if you have many processing units, you can store the pulp there, and at least the farmers can get some remuneration. So so India needs more cool rooms and cold storages.
Correct.
Where you can preserve whenever there is a drastic fall in the prices of perishable products, vegetables, fruits, you can store them, and government of India and also state government should come out with a formula of fixing a minimum price.
Correct.
For all essential agricultural commodities.
So the farmer can confidently invest and at least know that at least this much he will get back.
Correct, correct.
So
that is an area, and of course another burning problem in our constituency is particularly across Banerghatta, then Kanakpura and Satanur. There is elephant intrusions into the agricultural lands. And also they are killing some farmers and all. So we need to, of course, erect what is called using this railway track, old rails, railway track, old rails. You have to build a wall actually.
Okay, kind of a fencing so that they don't enter the civic area.
Yeah, so that is also an important thing. And most important, drinking water should be provided. Drinking water, roads, and you have to improve the healthcare services and schools. See, problem is health and education we always talk as priorities. So it should not be on the lips actually. So we have to strengthen the healthcare system by providing more manpower, not at least adequate manpower. Same thing is also applicable to schools. Schools and colleges also, they do not have adequate number of staff, faculties and supporting staff. So this is where we have to improve.
Sir, one interesting question I have is, if you had rupees 100 crore to spend for the public good, where would you invest it first and why?
Now, if you have that, I think rather than putting the entire 100 crores on one particular project, you split across 4 priorities. 25 crores are on health, another 25 on education, and another 25 crores on infrastructure. Then the last 25 crores is for environment.
Okay.
That is regenerating lakes and improving the groundwater table and all those things.
And as a citizen of this country, I feel very proud, sir, that having a highly educated and able administrator as our member of parliament here in Bangalore Rural. And I'm sure whatever the transformation we have seen in Jayadeva, similar things would also happen here, down the line in the many years to come. And I'll move on to the last section. Dr. Manjunath, you have healed hearts and built institutions. And what's your message to young Indians about the role of money in building not just wealth but wisdom?
See, nowadays, yes, because there is IT boom is there, a lot of startups are there. So, in fact, till 2004, I was told there are only 500 startups. Today, it is touching 1.27 lakh crore startups. So, there is lot of opportunity for young Indians. So, because earlier, I mean, only thing was they were looking for a job. Yes, that is a priority. Okay, even if you get a job, it's always fine. Nowadays, the trend is becoming, okay, I should work for some time. So, an employee is becoming an employer.
Employee to entrepreneurial
journey. That is there. But most important, you should not lose hope.
Correct.
And initially, you should work in an organization, and you should not hesitate to take some help or support from others, and you should discuss these things, and there should not be any ego clashes. See, many talented people many people with money or many people with the great brain and talent, they have gone down the drain because of ego. There should not be any ego clashes, and one should try to help each other. You should share your knowledge, you should share your business tips, and they should share their experiences, and they should promote each other. I think that is one, and definitely there is lot of opportunity, and one should have patience. So unless they have, because a good time will come, but they have to have a tremendous patience, and they should have a self belief. They have to believe in themselves, and they should have faith in themselves, and there will be an opportunity, and they have to come up step by step.
Correct. Thank you so much. That's a wonderful message for all the viewers watching this show. And the final thoughts, sir, on Har Ghar Crore, the financial education initiative, through improving the money quotient, the new formula that is done. How can it change the future of Indian families? The
No,
education.
because see, probably we have to promote this Gruha Kaigarike, I mean, whatever, Gudi Kaigarike.
Correct.
Those things, of course, there is a national livelihood program is there. So I think every household, see, they have to get involved in some work actually, because
Correct.
physical inactivity is not good, both as far as health is concerned, as far as wealth is concerned. And small these household industries, house based industries, they should develop, and they should and you have to invest in such a way it always appreciates.
Right.
It should invest in such a way it appreciates, and small business also, we should always have small clusters. Whatever small businesses you are doing at the rural level, you should have small clusters. Then you should also develop marketing, particularly a lot of people in the rural sector actually, I mean,
They
have
can make wonderful goods
they
and
have
crafts and all that, but selling is a difficult thing.
yeah, they have to have an online marketing, and that's where others should pitch in and try to help them. They have to create a marketing, they have to create a brand, they have to create a trust in their business, and of course other people also should support, because the packing is the one that makes it more popular and more
Correct.
acceptable, because even if you have a loose products, then it is not really attractive. So that's how we should promote.
They have to become very smart business people in terms of not just making the products, even selling the products.
Yeah.
That's a wonderful message, sir. The last and the final question, but not the least, one financial habit that you follow, that you wish that every Indian did too, what would that be?
No, actually, you should spend your money according to your needs.
Correct.
And it should actually match your pocket. Okay.
ಹಾಸಿಗೆ ಇದ್ದಷ್ಟು ಕಾಲು
You
ಚಾಚು.
should whatever spending you are intent to do, you should match your pocket and be satisfied.
Thank you. Wonderful, sir. Dr. Manjunath, thank you for your time and your insights and your lifetime of service. From surgery rooms to policy rooms, your journey is the proof that money, when aligned with purpose, becomes a force of good. Thank you so much, sir.